Hello, this presentation is on active shooter response and bullying prevention in the workplace. The objectives of this presentation are to understand how to prepare for an active shooter scenario, to understand the nurse's responsibility during an active shooter scenario, to understand the definition of bullying, to understand why bullying is a problem, and to recognize the nurse's responsibility when bullying occurs. While active shooter situations in healthcare environments should be inconceivable, they do happen and more often than one may think. These attacks are highly difficult to predict and can happen from the most unlikely group or individual. There are many variables that can lead to an active shooter situation. Patient or family member frustration, heightened anxiety over diagnoses, and poor communication are a few of those factors. Others include disgruntled employees, domestic violence situations, mental health patients, overcrowded emergency rooms, lack of staff, and the media. The best strategy to deal with these situations is to be prepared. This section of the presentation will discuss protocols and procedures in place at one facility and the responsibilities of the nursing staff in an active shooter situation. At the facility this presenter works at, our protocols include ensuring the receptionist makes an announcement stating that there is an active shooter. The announcement is made 3 times. The receptionist also locks the front door so no one else can enter the building. We have quarterly situational training where we sit around a table and go through an active shooter situation, what we would do, how we would respond, and try to imagine how we would feel and what we would need for support after the situation occurred. We ensure that everyone knows escape routes. They're posted on each floor so that you know where to go in case of an active shooter or a fire emergency or some other emergency where people need to evacuate quickly. We have walkie-talkies available on each floor for each of the managers. The facility is locked during low traffic times from 8 p.m. to 6 a.m. when there's fewer staff members to be able to monitor the situation. Video surveillance inside and outside throughout the entire facility and on the grounds. And the administration has access to cameras on all cell phones so they can see what's going on each of the floors and throughout the property. And every time we hire a new person, there's a full background check completed. Our preparations include a multidisciplinary planning team, administration, management, local law enforcement all get together to determine what the needs of the facility would be should a situation occur. We review all the available resources that we have within the facility and what is available in the community. Our policy and procedure manual is updated at least twice a year. We do training during orientation week on active shooter scenarios, and we also conduct it yearly as a refresher. All codes and key fobs are kept safe within the facility. No one is allowed to share any codes or give somebody else their key fob. And there is a designated employee meeting area outside the building should we need to evacuate. So what are the nurses' responsibilities during an active shooter situation? Well, they have responsibilities to the patients and they also have responsibilities to themselves. To the patients, they should be assisting any ambulatory patients to a safe area out of the building as they are able. As they're leaving, they should close patient doors If they can't leave, they need to assist patients to a safe place and lock or barricade the entrance to that place. And if they have no other choice, they fight back. Responsibility for themselves, get out of the building if possible. And you really can't take anyone that can't easily go with you. You need to, if you can't get out of the building, you need to hide and barricade. And you can do that with patients, making sure that everyone stays quiet, safe, cell phones are off, and just minimize any disturbance as much as possible. And again, if you can't hide, you got to fight back if there's no other choice. And call 911 when it's safe to do so, just to make sure that somebody has. Most importantly, stay alive for yourself and for your patients. Bullying in the workplace. Nursing is seen as a caring profession. Unfortunately, it is also one in which bullying occurs quite often, and usually it's nurse to nurse. This section of the presentation will define bullying, why it is a problem, who it impacts, what should be done when it occurs, and the responsibility of nurses witnessing acts of bullying. Bullying is defined as the habitual intimidation or harm to nurses one believes to be vulnerable and possibly incompetent. It has several characteristics. It has a negative impact or effect on the person. It elicits feelings of abuse, intimidation, and stress. The behavior is persistent, and it is perceived as bullying by the victim. Types of bullying behaviors include opinions and views are ignored. Information affecting one's job performance is withheld. Impossible targets and deadlines are given for tasks. The person being victimized is often ridiculed or humiliated. Key areas of responsibility are replaced with trivial or unpleasant ones. All decisions are systematically challenged. Aggressive behavior such as shouting or threatening physical harm often occur. Bullying is not an occasional angry outburst from one colleague to another. It is not constructive feedback given, and it is not having a difference of opinion. So, with more than 50% of nurses reporting some form of bullying in the workplace, it's highly important to understand the impact of bullying both to the victim and the organization. The impact to the victim, it causes feelings of isolation, insecurity, fear, loss of value, powerlessness, and vulnerability. It can often result in nurses either leaving the job or the nursing profession entirely. It can cause physical distress and psychological distress, including depression, sleep disturbances, headaches, eating disorders. Impact to the organization, more than 30% of victims reduced their time at work, withdrew from certain tasks, and decreased their commitment to work. This can cause patient care to suffer due to decreased staff members available to help with tasks. It increases errors because the victim of bullying becomes flustered and they're not able to concentrate, which results in medication errors and patient injuries. The victims also have decreased levels of motivation and commitment to the facility, and it causes increased absenteeism. And finally, it results in poor collaboration between healthcare professionals, which also impacts patient care. Some suggestions for nurses that are being bullied. Initially, recognize the behavior is unhealthy and can be potentially negative for patient outcomes. Try to discuss the behavior with the colleague that's bullying. Maybe they don't realize that that's what they're actually doing. If the behavior continues, go to a supervisor and make them aware of what's happening. The emotional intelligence approach is reflecting on the situation before acting. Make sure that you're monitoring your own feelings and the feelings of those around you so that you can use good judgment, and be willing to discuss the situation objectively. Other approaches include taking a moment to be calm and reason through the situation. Avoid labeling individuals as bullies. Gather your data. Approach the subject matter under the idea of safe patient care. Finally, keep a sense of humor. Know your limits of tolerance. A good sense of humor and a positive outlook make you much more resilient and able to continue doing your job. Bullying prevention is the responsibility of all nurses. All nurses need to recognize bullying behavior and speak up for the victim. The organizations need to have a zero tolerance attitude for bullying, and the staff needs to be behind that attitude. Colleagues of staff being bullied need to provide support to increase resilience and hope of an end to the bullying. These are the references for this presentation. Thank you.